for your next 2 decades of your life. So these are the things you would be sort of keep an eye on. STIs, that is sexually transmitted infections, and they are quite common. Okay, and the problem is what happens is men's genitals are on the outside. So if they have any redness, discharge, ulceration, bleeding, it is visible. So they can seek help quickly and get treated. Problem is, girl's vagina is inside the body, uterus is in the pelvis, tubes are in the pelvis. So it takes a while or a really big dose of inoculus of the bacteria or virus to cause infections and symptoms. So it is quite possible that women might not become symptomatic, or they will become symptomatic only when the disease has progressed. And that puts them at a very high risk of sort of facing the issues caused by these infections later on. For example, chlamydia, 70% of chlamydial infections are asymptomatic. Okay, it doesn't cause any issues to you as such, but the bacteria goes up the uterus and damages the tubes. And we see the after effect in fertility clinic when they come to me and they are not getting pregnant. When I scan them, their tubes are damaged and filled with fluid. Okay, so I'm not sure if it has come to India, but in the UK, there is a very nice system that whenever two people come together and they decide to sort of get involved physically with each other, they would go to the sexual health clinic and get tested for any infections and get a treatment. And once they are clear, then only they will get involved. And until such point, use barrier contraceptives. Okay, pills, coil, and all those things, they help you to stop getting pregnant, but they don't help you to stop getting an infection. So the only thing stops you from getting an infection is a barrier method like a condom or a female condom. So this is your age, you might be getting deciding or planning to get sexually active. So it is very, very important that you know of these things. Menstrual irregularities, as we said, it's the whole chapter. The problem could be from your brain to your ovaries to your uterus. So that's why it is very important to keep a track of your cycles and know your body, know your rhythm, and any changes, if they are persistent, you need to seek help. PCOS is polycystic ovarian syndrome, and it is diagnosed by having two of three things. So, one is no cycles or irregular cycles. So, simple rule of thumb is if you release an egg regularly, you have a regular cycle. If you are releasing an egg irregularly, you have irregular cycles. And if you don't release an egg, you don't have a cycle. Simple as that. So PCOS is you either release egg irregularly or you don't release at all. So there is no cycles or irregular cycles. Second, when we scan you, we see lots and lots of follicles. So it's a misnomer. Okay. Even though its name says polycystic, they are not cysts, they are follicles. So we see lots and lots of follicles on the ovary. And third is either your testosterone is high when we do a blood test, or you are sensitive to your own testosterone, which is oily skin, spots, facial hairs on upper lip, chin, chest, and all those things. So if you're experiencing these symptoms, the management will change. If you're not planning to get pregnant, the treatment is different. If you're wanting to get pregnant, management is different. Endometriosis is a condition where a tissue which resembles lining of the uterus is actually growing outside the uterus. So it can grow on the uterine surface, it can affect the uterine muscle, it can grow on the ovaries, back of the uterus, and in severe cases, it may involve bowel as well as bladder. And the symptoms are heavy periods, spotting, very painful periods. But the other major problem is that your symptoms and severity of the disease don't go hand in hand. So I have a patient who has a 10 centimeter cyst filled with blood with zero symptoms. Okay. So, but if they are there, it is always better to get investigated. Fibroids is a growth of muscle of the uterus, and they can range from size of a grain to size of a football, and they will cause problems based on their size and location. If they are affecting your cavity, they can affect your pregnancy or chances of getting pregnant. They can make your periods heavy and all those things. Ovarian cyst, they are of different types. One is we call simple cyst, which has got only yellow colored fluid, a hemorrhagic cyst when you bleed into it, a dermoid cyst when you grow different things in the cyst like hairs and bones and fat cells and everything, endometrioma, which is a spectrum of endometriosis where old blood collects in the cyst, or cancer or borderline tumors. Okay, we don't worry about small ones. We worry about when their size is more than 5 centimeter, because then they can twist and you may end up losing the whole ovary, or obviously the cancers. Uterine anomalies, I showed you the diagram of uterus, so the cavity is a bit triangular. The reason for it grows with two tubes joining, and the middle wall fuses and gets reabsorbed. So the resulting cavity is triangular. So when this resorption is not complete, that can give rise to different problems. Subfertility, when people are trying to get pregnant but are struggling if they have been trying for more than a year, and then they should seek help. Cervical cancer is very common in India. Uh, it is predominantly caused by a virus which is called HPV, human papilloma virus, and it is actually a sexually transmitted infection. So people need to be very, very wary. The problem starts that when the age of the girl is young, at a when she becomes sexually active, because by that time the lining of the cervix hasn't developed enough or matured enough, and the virus gets it infects the lining and stays there dormant, and eventually leads to cancerous changes. So up to age 25 they can go for the HPV vaccine. It's called Gardasil. Gardasil contains, I think, 4 or 6 variants, and you need 2 doses 1 month apart. So, if you have just recently become sexually active or not become sexually active yet, is the right thing to do, because it is practically eliminating the cervical cancer. And for older people, there is a test. It's called a cervical smear, where you go to the doctor, they take a smear from the lining of the cervix, and they look under microscope and see if it has got any abnormal cells or not, and it needs to be done every 3 years at least, provided it is normal. If it is abnormal, then your gynecologist will be able to guide you about the treatment options. But the good thing is it is picked up early before it causes or spreads, causes more damage. Uterine and ovarian cancer, uterine cancer is more for older women. Ovarian cancers can be quite early on. But again, the symptoms are very, very difficult. And that's why I said that it is important that you understand your body, and any deviation, you need to get investigated. And disorders of hormones like thyroid, pituitary, hypothalamus, and those things, but they will sort of reasonably rare.